Lotrel contains a combination of amlodipine and benazepril. Amlodipine is a calcium channel blocker. Amlodipine relaxes, widens blood vessels and improves blood flow. Benazepril also widens blood vessels and also prevents the body from retaining water. Indications. Lotrel is indicated for the treatment of hypertension in patients not adequately controlled on monotherapy with as agent. How to use. Take Lotrel exactly as prescribed by a doctor. Follow directions on a prescription label and read all medication guides or instruction sheets. Your doctor may occasionally change your dose. Use the medicine exactly as directed. You may take Lotrel with or without food. Take the medicine at the same time each day. Usual adult dose for hypertension. Initial dose: amlodipine 2.5 mg, benazepril 10 mg orally once a day. Maintenance dose: amlodipine 2.5 to 10 mg, benazepril 10 to 40 mg orally once a day. Maximum dose: amlodipine 10 mg per day, benazepril 80 mg per day. Contraindications. Lotrel is contraindicated in patients who are hypersensitive to benazepril or any other ACE inhibitors or to amlodipine. Warnings. Don't use Lotrel if you are pregnant. If you become pregnant, stop taking this medicine and tell the doctor right away. You should not use this medicine if you have ever had angioedema. Don't take this medicine within 36 hours before or after taking medicines that contain sacubitril, such as Entresto. Drinking alcohol with this medicine can cause side effects. If you're driving or hazardous activity until now has this medicine will affect you. Your reactions could be impaired. If you have diabetes, don't use Lotrel together with any medications that contain salirskirin, a blood pressure medicine. Side effects. You may not feel any side effects from taking the drug or have only minor effects. Talk to a healthcare provider if these common side effects continue to bother you: dry cough, edema, swelling, headache, dizziness. Severe side effects: allergic reaction, rash, hives, difficulty breathing, or swelling of the face, tongue, lips, or throat, edema, swelling of the feet, hands, ankles, or face. Rare side effects can be severe include hypertension, low blood pressure, neutropenia, a condition caused by low levels of neutrophils set up of white blood cell, hyperkalemia, hypotassium levels, thrombocytopenia or low platelet count, a granulocytosis, a blood condition caused by too few white blood cells called granulocytes, pancreatitis or inflammation of the pancreas, Stevens-Johnson syndrome, a rare type of hypersensitivity reaction, pemphigus, a rare group of autoimmune diseases affecting the skin and mucous membranes.